Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, getting bitten by an animal can happen to anyone. Many types of animals can inflict bites on adults and children. So to discuss on this, we have with us in studio Dr. Sthapana Sarmah. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Thank you so much, Dr. Sthapana, for coming to our show. And animal bites. Animal bites is a very common thing which we see and we hear from many of us. So how to prevent that? What are the causes, symptoms? So we'll start with animal bites. So what would you like to start with?
Thank you, Pooja, to having me back. And I would like to use this platform to wish our viewers a very happy new year. And coming back to our topic for the day, animal bites, I think it's one of the most commonest problems which we hear, for almost everyday problem, and
right.
People are apprehensive about it. So animal bites, mostly if you see, it's a public health challenge now. It's a public health challenge because mostly if you see, it's when we say animal bites, it's usually the domestic animals, especially the animals near us, whether in a home or in the street. Bites from wild animals are rare, but that also accounts to almost about 1% of the total hospital cases that we have for animal bites. But otherwise, it's mostly bites by dogs, which accounts to around 97%, and bites, even scratches and bites by cats, almost 2% of cases reported. So yes, in today's day, it is a public health challenge.
It's a public health challenge, and it's not necessary that it can happen with anyone. Yeah. So one has to take a very good care of themselves, and they have to take some of the precautionary measures as well.
Exactly.
So how can like an animal bite be dangerous, doctor? So what would you like to tell on?
See, when it comes to an animal, it depends on whether there was just a lick by the animal, or whether it was a scratch, or it was a proper bite with teeth marks. And animal bites, usually we usually have it synonymous with rabies. So rabies is 100% fatal disease. If inflicted with that virus, it's a viral disease, and if inflicted, it's 100% fatal disease. So unfortunately, if that animal which has bitten you is a rabid dog or a rabid cat or any rabid animal, then that can be fatal.
Okay.
It's very dangerous.
Okay, so immediately then you should have a check with your doctor, and immediately the treatment should start.
Immediately, yes. As soon as you are bitten by a dog, or maybe a scratch by a dog, or maybe even if you are suspecting a mild scratch or even a lick, then you should immediately consult a doctor and show him that portion, what happened, and give him a brief history about it. Yes.
There are a lot of types of animal bites if we talk about that. So what would be that if in general our viewers would like to know about it?
Animal bites, as I've told you, that hospital records in today's, if we go by the program, that shows around 97% of the animal bites reported are mostly by the dogs.
Okay.
Dogs, because maybe it's because they have a closer proximity to human population or have human habitation, whether in the streets or at home. And only 2% accounts by cats, and 1% by wild animals. So this 1% by wild animals, whether any type of bite, whether it was just a scratch or a proper bite, we consider it as grave, serious.
Okay.
We keep them in the category 3. Category 3. I'll tell you slowly in how we categorize the bites or the attacks, and then rest are depending on the situation, depending on the nature of bites or the scratch, we categorize the patient.
Okay. All right, so category of patients depends on the intensity of bite.
Yes.
So we'll talk more on this, but let's take the phone call. Hello?
Hello, I apnalokor program to sai asu. Actually, more ভন্টিজনী আজি 4-5 বছৰ আগত মেকুৰী কামুৰা নাছিলে, আচুৰিছিলে ঘৰৰ পোহনীয়া মেকুৰী এটা। এতিয়ালৈকে কিন্তু একো ইনজেকশ্যন লোৱা হোৱা নাই তেনেকে। আচুৰতে কিন্তু তেজো ওলাইছিলে। ইয়াৰ কিবা মানে প্ৰব্লেম হ'ব নেকি ইন ফিউচাৰ?
4-5 বছৰ আগতে কৈছিলে, 4-5 বছৰ ইউজুৱেলি ইমান দিন নাথাকে, ইনফেকশ্যন নাথাকে। চ' এতিয়ালৈকে একো ভয় নাই, আৰু মানে প্ৰিকশ্যনছ ল'ব লাগিছিলে, তেতিয়াই ল'ব লাগিছিলে। এতিয়া ইমান ভয় নাই কথাটো, কিন্তু নেক্সট টাইম অকণমান সাৱধান হ'লে হ'ল। Mekuri infection, kamura to 5-6 years ago, iman sinta korba laga nohoy.
Unless and until if there is any symptom or any
that symptom
problem
would have
she's
shown.
that symptom would have shown
then.
Okay.
But now it's 4-5 years is a big gap now.
Okay.
Yeah.
So let's talk about where we had a general understanding about animal bites. It can happen with anyone. So types of animal bites, and depending on the category, the treatment starts, and the medicines or whatever injections are needed that is being given.
Yeah.
So if we talk about the first aid or the treatment for an animal bite, any kind of animal, especially we hear about dog bites.
Yes. So the dog bites, as I've told you, it's the commonest type. And as soon as you have a bite by a dog or a lick, even by a scratch by a dog, you need to observe the area where you have been attacked. So first thing is, if you see that there is a scratch or a bite, the first thing we need to do, the first aid that we need to do is water. Wash the wound with water. Sometimes it happens that the patient comes to us immediately. If a very conscious patient might come to us immediately, and then first thing we do is wash that area.
Only with water?
Only with water and soap. Okay. We can wash it with soap. And even if you don't come to the doctor immediately, you can do this preliminary first aid. You can even do it. Yeah, yes, exactly. You do it at home. Clean with water, especially running water, and soap. So this helps to clean away some of the virus or wash away some of the virus that might get enter into the system.
Okay.
And after that, you come this thing, if you do it at home, then obviously after that please come to the doctor. Or if you have already come to the doctor, the doctor has given you this first aids by cleaning the wound, and then now we examine the wound. But how grave is this injury, attack? If it is very bad attack, multiple attacks, or it was a very deep one with lots of bleeding, then we might have to go categorize the patient into a higher group and take the treatment as usual. And the most important thing in case of animal bites is that here we go for post-prophylaxis treatment. Post-prophylaxis, that means after that we do not know if the animal was a rabid dog, but still we are going to take precautions, and that's why we call it post-prophylaxis.
That is a very important question, because whenever someone has been bitten by an animal, especially dogs, so we never know that maybe the dog, or maybe if suppose it is in the case of the street dogs, so always it's better to take the rabies, and it's always good to consult the doctor that what is the initial injection or what is the initial medicine to be taken?
Yes, Pooja. In fact, I would always suggest that it's said that even if it's a domestic dog or a cat who has been vaccinated, you have a proper schedule of the vaccinations with a proper card, but still we do not know the efficacy of that vaccine on that dog.
That's a very important thing, because if suppose any person or in a family member, they want to keep a pet, and the pros and the cons, and also what to do and what not to do, it has to be they should also have a list of everything, and it should not that you have a tendency to keep a dog and you have just kept it, but you have to take a good care of that pet. And then also you have to take good precautionary measures also, that what injections or what type of medicines has to be, you have to consult a veterinary doctor for that.
You have to consult, and you have to need to keep a record. But still our program says that even if you have vaccinated your dog or you have kept a proper records, but we do not know how effective the vaccine is on that dog.
Right, and so accidentally you might...
so we always say that if you're having a cut or scratched by a dog, depending on the injury, we have to take the post-prophylaxis. We usually give them post-prophylaxis. In the meantime, we go for observation of the dog or the animal which has bitten. We usually go for a 10-day observation, and based on that, we do not fully depend on that observation for the 10-day observation, but otherwise, based on that, we might just cut short the needed injections. So we are supposed to take 5 injections now, then we can skip 1 injection, that is on the 14th day. Depending on the condition of the dog.
So has the number of vaccination, the numbers have been lessened nowadays? Because earlier it was, like we used to hear 30, 32, like, and those
especially
were like,
around bilicus, 14 injections.
So whenever a person hear about that, they get scared, and
that is
the moment they get stopped. So after that, what to do? So now have the numbers lessened now?
Yes, nowadays with times they have modified, the vaccines have come, we have got good vaccines, better vaccines vaccines with high immunity. So yes, the vaccines have come. Nowadays, the schedule is much less than the 14 injections which was there earlier around umbilicus. We give it IM, intramuscular, and even sometimes even better injections have come which is given intradermal, which is even more superficial. So these are very effective vaccines and works very well.
So there is a time frame, like you don't take all the vaccinations in 1 week, or there is a time frame. You get a chart and then you have been asked that you have to come on this particular day.
Yes. So for that, immediately after the bite, on that day, on the day when the patient comes to you, we consider it as a 0 day. And there we need to give the first dose, and then we give another on the 3rd day, then we give another on the 7th day, then we give another on the 14th day, and 21 or 28 days. So it's a 5 days schedule now.
So is there anything like you have to take care of your diet or anything you have to take care of your food? Because there is a myth. There is a myth like people or the family members or your relatives talk when you have been bitten by a dog or any animal, you should not have ghee, you should go for boil. So are those things true?
No, nothing has been documented till date. I mean, there's no restrictions on that, not at all. But this myths has been going on and has been followed. Maybe it gives some kind of relief to the patients or the family who has been beaten by it. But yes, from documentation point of view, nothing. There's no restriction. Whether you are taking the vaccines, whether you are taking any medicines, and
so there is no such restrictions in taking your food. Maybe it's like you are not allowed for spicy or something. That is in your general life. You're not allowed for any fast food or something like that. But when you have been under medication or under any medication, something, so that is a very much precautionary measures as well.
These are precautionary measures which are taken by the family. But usually when it comes to documentation, first thing is that the PEP or the post-prophylaxis treatment that you need to take, it's a must. It's a must because let me again tell our viewers that rabies is 100% fatal, and unfortunately if your dog is a rabid dog, then it can lead to grave consequences.
All right, doctor, we have a phone call. So let's take the phone call. Hello.
Hello.
Hello. Apnar prashno to koribo?
Hey, মই সুধিব বিচাৰিছো যে আমি যিহেতু কুকুৰ বা মেকুৰীয়ে কামুৰে তেতিয়াহ'লে নৰ্মেলি গাঁৱলীয়া দৰৱ খোৱালে বেছিকে ভাল নে আমি এলোপেথিক ইউজ কৰিব পাৰোঁ?
Okay.
আমিতো থ্যাংক ইউ আপোনাৰ প্ৰশ্নটোৰ কাৰণে, কিন্তু আমিতো সদায় কম যে এলোপেথিক আমি ভেকচিন স্পেচিয়েলি পোষ্ট প্ৰফাইলেক্সিছ বাৰে বাৰে কৈ আছোঁ এই কথাটো, কাৰণ পোষ্ট প্ৰফাইলেক্সিছ যোনটো ভেকচিনেশ্যনছ ল'ব লাগে সেইটো মাষ্ট। আপুনি ডক্টৰৰ তাত আহি পেলাই এবাৰ আমি যোনখিনি ইনজুৰি কিমান হৈছে, কামুৰিছে বা কাটিছে, কেনেকৈ কৰিছে, কিমান ইনজুৰি হৈছে সেইটো চাই পেলাই আমি আমাৰ ভেকচিনেশ্যনছ কৰোঁ। আৰু তাৰ উপৰিও যদি খুব বেছি হয় তেতিয়া কেতিয়াবা ইমিউনোগ্লোবিলিনো দিব লগা হ'ব পাৰে বিচাইডছ ভেকচিনছ। চ' এইখিনি কৰে মই সদায় ক'ম যে ভেকচিনছ ল'ব। গাঁৱলীয়া দৰৱ আপোনালোকৰ বিশ্বাসৰ কথা, কিন্তু ভেকচিনছ নোহোৱাকৈ নহয়।
All right. Thank you so much for calling. All right, doctor, we'll proceed with our conversation, but right now we'll have to slip into a short break. All right, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. Sthapana Sarmah on animal bites. And doctor, let's proceed and let's talk about the healing time frame. So how long does it take to heal the animal which it has bitten to any particular animal?
Yes. So when the animal bites, again, you have to see what is the intensity. How grave is the bite. If the bite is very grave, I would like to add one point here, that when it comes, even for the doctors, when they go for the first time and it's a very deep bite and has led to lots of oozing of blood, even then, one thing we always take precaution is we do not suture the wound. Usually when we suture, it says that it might get the virus more into your system. So we give minimum sutures till we take him to a proper care. If it's very big bite. But less suture and wash the wound, and then the wound will heal at its own course, but our precautions in terms of vaccination, that's the only thing we can do here. Let me put, because besides vaccination, and sometimes you need to go for a tetanus toxoid together to ward off side infections, but maybe because it's an injury. So for that we are giving tetanus toxoid. Tetanus toxoid is not against the rabies virus. Yeah.
And with diabetic patients, you have to be very careful, I think. Like,
yes,
because
of
the
course. Healing process will be very slow. So her sugar control, her sugar level has to be maintained properly, and then extra care has to be taken on her diet so that her sugar doesn't shoot up or any untoward happens.
Okay.
Yes.
Suppose suppose my friend, she has a pet in her home, so she plays a lot with her. So sometimes you see scratches. So is it necessary for her to always keep a check with the doctor and ask about the precautionary measures, or she has to, unless and until something major has happened, she should go?
See, when it comes to her pet dog, firstly, she is well aware how her pet dog is behaving. So, rabid dogs usually, when they are infected by rabies, they behave a little different from other normal dogs, or even cats. They do not behave. Firstly, they have excessive of salivation. They try to stay away from humans. They try to stay in a particular corner. Excessive salivations, and they behave they are fearful. So these are the symptoms. Otherwise, if it's a domestic dog, and since your friend, if she is well aware of her vaccination status, about the immune status of the then she needs to consult a doctor. It's not that she doesn't, but all the time vaccination might not be needed if it's a small scratch. Yeah.
Okay, if not all the time, but sometimes if it is major, then
if it is major, then even if it's a small scratch, she needs to consult a doctor. But then, yeah.
So there are a lot of things like like everyone has to keep a note of it. So other than that, like other than the technicality part, so what are the other things like doctor one should keep a check on it about their pet and whatever?
Yes. So one thing I always have noticed, and this is very unfortunate, that even today when we have patients coming with animal bite to our clinics, we see that usually before they come, some local treatments has been done in that.
Right.
So usually they give some, whether they give some herbs or local chilies, or even we have seen to give, these are all irritants which are going to irritate the area.
Absolutely.
And might lead
chilies you can't imagine on a bruise.
It's thought that maybe the chilies will kill the virus or something. We have seen cases like this, or local herbs and local, we do not advise such things, because this will further aggravate the infection. Yes, if it's irritating the area around, it will lead to the virus entering into the system. So we
it's
do
very
not
difficult
advise.
for those person to make you guys understand that, like how you are going on a wrong path or something like that, because they will be seeing those things as the correct measures to heal those
and usually we have seen, Pooja, that when it comes to animal bites or even snake bites, or usually they go to the local quacks first.
Absolutely.
Local, so that, and they have their own way of healing, I mean treating. So they do this, and this is where the wrongs happen.
Maybe psychologically they think that these are the correct measures
these
to
are
heal
psychological
those pain.
boosters,
Absolutely.
nothing else.
But the person who is already suffering from this, that is a very big task for that person.
Big task,
you have to hear those things, and also if you are going to a doctor, then those precautionary measures and injections you have to take. But in vaccination is very important whenever
vaccination is the only thing that we have for, that's why post prophylaxis, it's the only thing that we have for rabies, besides the preliminary precautions. I mean, washing the wound and then giving, if it's very grave, then as I've told you, it's immunoglobulins. Besides the vaccines, we also give immunoglobulins in the local area if it's a very grave. And we categorize the patient, as I have told you, if it's just a lick, if it's just a lick with no abrasion of the skin, there's no abrasion, the skin is intact, it's just a lick, then we categorize it as category 1. And category 1, we just need to clean the area, no vaccines needed. But if there's been some abrasion in the skin, or there has been some mucus, because as I've told you, the virus is secreted by in the saliva. So if you think that the saliva has come in contact with your skin inside, there has been some abrasions, then we categorize it as category 2.
Okay.
And rest, if it is a fierce bite or by a wild animal bite, then we categorize it as category 3. And according to the categories, the treatment is different.
Nowadays, like medicines have updated, and as you have mentioned, the numbers have also been less. The days, number of days have been less. So lots of vaccinations have also come up. So is there any pre-vaccination which a person can take? Suppose if they want to have a pre-precautionary measures also to take. So are there those medicines available?
Yes, we have pre-vaccination prophylaxis. This is especially in case of special situations, like as you've told, you have a pet in your house and you know the pet, you might get a scratch or a bite, or sometimes specially laboratory people who have to handle animals while coming to the clinic, or the veterinary doctors who have to be constantly handling.
Right.
So for that, they do have pre-vaccinations, and this the schedule is almost like similar: 0 on the first day, 3rd day, 7th, and 28th.
All right, Doctor, we are really short of time. So on last note, what would you like to tell our viewers? What kind of like tips you want to give to them?
So based on the topic today, we have animal bites. We have seen that most of the complaints that people get, their first thing is apprehension. They get very scared as soon as they know that they have been either beaten or licked or scratched by a wild animal, and even a domestic animal. So my first note is, do not get nervous, stay cool and clean your area, and first thing is consult a doctor and get your vaccinations right.
All right, so the scaring part which you mentioned, that is a very correct thing, because the first thing, people get scared, and then if you get scared and you think that what to do and what not to do, so that is the confusion part. It creates a lot of like more confusion.
Very much. In fact, if it's a category 1, they might get apprehensive and make it into category 2.
Okay.
You know,
it's always better to consult your doctor. They will give you a good answer
good
and
advice,
good advice, and then things will be more easy for you. So I'm sure the viewers who have watched our show must be benefited, because we had a fruitful discussion on animal bite today. Thank you so much, Dr. Sthapana, for coming to our show. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.